So, hello everyone, and welcome to my new channel and podcast. By the way, the website YouBeMD.com is still not ready. It's gonna be ready soon, but you can subscribe for now. Subscribe for this channel. There is gonna also be a podcast soon related to this broadcast, and I'm gonna announce about it later. So the first topic that I'm gonna cover in this series, this is gonna be a series by which I will try to cover medicine, the whole bulk of medical material that is required for to be known by any med student. So this is mainly aimed for med students, and the first topic that I'm gonna be covering is anesthesia. This is gonna be a nice overview for you to have an idea about any topic that I cover here throughout the videos, or when you get to listen to them when they are prepared as podcasts, and when the podcasts are ready. That's gonna be also nice for you to listen while you are driving, or when you are involved with other activities. And I would like to get your feedback about the video quality, just your feedback about anything, the video quality, topics that you would like to be covered, anything else that you want me to add. So anything you leave in the comments, I would really appreciate. Don't forget to also like the video, to share it, so that you encourage me, you promote the channel, and you encourage me to create more videos like that, and more podcasts, and more content in general. So subscribe, share, and like. Okay, so the first topic that I'm gonna be covering is anesthesia, and the whole preoperative medicine in general. First of all, I'm gonna introduce the topic of anesthesia. There's gonna be a short introduction, and I will describe the types of anesthesia, and then I'm gonna move to the preoperative assessment of the patient, before how you assess the patient before surgery, and then the preoperative optimization. This is important because you have to optimize the condition of the patient before the time of the surgery. So we're gonna talk about that. Under the preoperative assessment, when you have to assess the patient ahead of the surgery, you're gonna have to take the history, to do a physical examination, and we're gonna talk about the things that you have to focus on. Also the investigations that you have to request for the patient, and the classification of the American Society of Anesthesiology for patients before surgery and before the induction of anesthesia. Then in the preoperative optimization of the patient, by which you have to optimize the condition of the patient before the beginning of the surgery, we're gonna talk about the medications that you have to give or to stop or to adjust, whether the patient has hypertension, coronary artery disease, respiratory diseases, the fasting guidelines, aspiration, any hematological disorders, endocrine disorders, and obesity, any sleep apneas, obstructive sleep apneas. Then we're gonna move to monitoring of the patient. Then after that, we will be talking about management of the airway management, the methods of supporting the airways, and how are you gonna support the airways, the tracheal intubation, the cases where there are difficult airways and how to know that you are dealing with difficult airways, oxygen therapy, ventilation, any lack of ventilation that the patient may have. And then we're gonna move on to the topic of intraoperative management, by which you maintain the condition of the patient and throughout this general anesthesia and the surgery. And examples for this would be the heart rate, the blood pressure, the IV fluids, the blood products, the fluid balance, temperature, resuscitation. And then we will move on to the actual induction of anesthesia. We're gonna discuss the routine induction and the rapid induction, the rapid sequence induction. We will talk also about the induction agents, the muscle relaxants, the reversing agents, analgesia. Then after that we're gonna talk about the maintenance of anesthesia. After you induce anesthesia, you have to, of course, to maintain it. So we will talk about the maintenance of anesthesia. Then the extubation topic and the complications of extubation. Then we will focus on two other types of anesthesia besides the general anesthesia, which are the regional and the local anesthesia. For the regional anesthesia, we're going to be talking about epidural and spinal anesthesia, also about the peripheral nerve blocks. And for the local anesthesia, we're going to be talking about local anesthetic agents, systemic toxicity, and local infiltration, hematoma blocks, also about topical anesthetics. So that's all under the local anesthesia. Again, for regional anesthesia, the two other types of anesthesia, which are the regional, and the other one, which is the local anesthesia, we're going to be talking about the epidural and spinal anesthesia. That's one under the regional anesthesia, epidural and spinal anesthesia. The other one is peripheral nerve blocks. So epidural and spinal anesthesia, and the other one is peripheral nerve blocks. That's under regional anesthesia. Epidural and spinal anesthesia, peripheral and nerve blocks. Now, for the local anesthesia again, we will have the local anesthetic agents and systemic toxicity, and local infiltration and hematoma blocks, and topical anesthetics. So four main topics under the local anesthesia. Again, those are the local anesthetic agents and the systemic of systemic toxicity, the local infiltration and hematoma and topical anesthetics. Then after the surgery, we have to look at the post-operative care, and we will focus on the common post-operative anesthetic complications, which are the main and common complications that occur after anesthesia. And then we will focus. We will discuss the topic of pain management. Under the topic of pain management, the acute type of pain, the neuropathic pain, and the chronic pain. So acute, neuropathic, and chronic pain. For the topic of pain management. Then obstetrical, we will be discussing two specific cases of anesthesia that require more attention. That's in the case of obstetrical anesthesia and pediatric anesthesia. And then we will be talking about some uncommon complications like malignant hyperthermia and abnormal pseudocholinesterase. So again, I'm gonna go through the main topics that will be covered for anesthesia. There is the preoperative, first of all, the introduction of anesthesia and the types of anesthesia. We're going to see how there are three types of anesthesia, and then we will talk about the preoperative assessment and the preoperative optimization, and then the intraoperative management. During that, we will see the induction, the maintenance, the extubation, and then the post-operative care. And we will discuss special cases like the obstetrical anesthesia and the pediatric anesthesia, also pain management and uncommon complications. And under the preoperative assessment, we will talk about history and physical examination, preoperative investigations, the investigation that you have to do, the history that you have to take, the physical examination that you have to do on the patient, and the classification of a patient, American Society of Anesthesiology classification of a patient at the preoperative stage. Then the optimization, the preoperative optimization, the medication that you would might consider giving to the patient, or the ones that you have to stop, or the ones that you have to adjust. Hypertension, how to deal with it. Coronary artery disease, respiratory diseases, aspiration, fasting guidelines, hematological disorders, endocrine disorders, obesity, obstructive sleep apnea, and monitoring of the patient. and then the airway management, and then during the surgery and the anesthesia, you have to look at the stage of induction, and then the stage of maintenance and extubation, along with the complications of extubation. Then we will also talk about, as I said before, the the other types of anesthesia, which are the regional and the local. Under the regional, there is going to be the epidural and spinal anesthesia, peripheral nerve blocks, and under the local anesthesia, there's going to be local anesthetic agents, systemic toxicity, local infiltration and hematoma blocks, and topical anesthetics. And under the uncommon complications, there's going to be the malignant hyperthermia and the abnormal pseudocholesterase. Okay, so let's start now by each of these. I'm gonna cover in each video part of this until we finish together anesthesia, and then we will move to the next main topic. So now for anesthesia, I will start with the introduction of anesthesia. So what is anesthesia? Anesthesia is the lack of sensation or perception. That's when you induce, or when it is when the patient has a lack of sensation or perception. That's anesthesia. And the approach to anesthesia is by the preoperative assessment and the patient optimization, and you plan the anesthetics, the pre-medications, the airway management, the monitoring that you're going to do for the patient, the induction, the maintenance, the extubation, the emergence, and then there is the post-operative care. And for general anesthesia, we have 6 A's. 6 A's. The first A stands for anesthesia itself. The second A is for anxiolysis. Okay. The third one is for amnesia. The fourth one is for areflexia. And this is not always required, the areflexia, which is the muscle relaxation. And then the fifth one is the autonomic stability, and then the analgesia. So A, anesthesia, A, anxiolysis, and A for amnesia, A for areflexia, A for autonomic stability, and A for analgesia. And now let's talk about the types of anesthesia. The types of anesthesia are in the general, the regional, and the local anesthesia. The general anesthesia is divided into general anesthesia and total IV anesthesia. The regional anesthesia is divided into spinal and spinal epidural, and peripheral nerve block, and IV regional. So the regional is divided into spinal epidural, okay, peripheral nerve block, and IV regional. 3 ones: spinal epidural, peripheral nerve block, and IV regional. The local anesthesia is divided into local infiltration and topical anesthesia. So again, the general, regional, and local. The general is the general anesthesia itself, and the total IV anesthesia, while the regional is the spinal epidural, the peripheral nerve block, the IV regional, And the local is the local infiltration and the topical. And remember that different types of anesthesia can be combined and can come together, like the general and regional. Okay, and now let's move on to the pre-operative assessment topic. The purpose of this and why you are doing this is you want to see if there is any risks that the patient has that would affect the anesthesia and the surgery. You do first you take the history and then the physical examination. For the history you have to focus on the age of the patient and the gender of the patient, of course. What is the indication for the surgery, and what is the surgery itself? Okay. The surgical anesthetic history, any previous anesthetics that the patient has taken, any previous complications throughout surgeries, any previous intubations, the history of medications, also drug allergies that you should be aware of. Okay, and then you have to know any abnormal anesthetic reactions and malignant hyperthermia, pseudocholinesterase deficiency, and the family history. That's all in the family history. Any abnormal anesthetic reactions, any malignant hyperthermia, and any pseudocholinesterase deficiency. And then you have to know about the general condition of the patient, the central nervous system, any seizures, any TIA, strokes, any raised intracranial pressure, any spinal disease, any aneurysms, and for the cardiovascular system, you have to know any angina, coronary artery diseases, angina or coronary artery diseases, also myocardial infarctions, CHF, hypertension, valvular diseases, dysarrhythmias, peripheral vascular diseases, and conditions requiring endocarditis prophylaxis, exercise tolerance, CCS-NYHA class. And for the respiratory system, you have to know the history of smoking, histories of asthma, of COPD, of any recent upper respiratory tract infections, and any sleep apneas. For the GI system, you have to know any gastroesophageal reflux disease, any liver diseases, the NPO status. For the renal system, you have to check for any insufficiencies, any previous dialysis, any chronic kidney diseases. For the hematologic, we have to check for any anemia, any blood dyscrasias, any coagulopathies. For the MSK, you have to check for any conditions associated with difficult intubations, arthritis, like rheumatoid arthritis, cervical tumors, cervical infections and abscesses, any trauma to the cervical spine, any previous cervical spine surgery, also trisomy 21, scleroderma, conditions affecting the neuromuscular junction like myasthenia gravis. You have to know about all of these. For the endocrine system, you have to know about diabetes mellitus, adrenal disorders, and thyroid disorders. Other things that you have to know about are any cases of if they have any morbid obesity, pregnancy, ethanol or other drug use. So that's all for the history. After the history, there is the physical exam. For the physical exam, you have to take the weight, the height, the blood pressure, the pulse, the respiratory rate, and the oxygen saturation. Also the focused physical exam of the central nervous system, the cardiovascular system, and the respiratory systems. Also you have to do general assessment of the status of nutrition, hydration, and the mental status of the patient. Also you have to do airway assessment to determine any intubation difficulty. And by the way, no single test is specific or sensitive. And also, in addition to the intubation difficulty, the ventilation difficulty. Remember, there are you have to assess for both the difficult airway, for intubation difficulty, and ventilation difficulty. There is the cervical spine stability. There is the cervical spine stability and neck movement, the upper cervical spine extension, lower cervical spine flexion, that's the sniffing position. Again, the cervical spine stability and neck movement, upper cervical spine extension, lower cervical spine flexion, the upper cervical spine extension, the lower cervical spine flexion. That's the sniffing position. Also the Malampati classification. Also the 3-2-1 rule. For 3-2-1 rule, you have the thyromental distance. This should be less than 3 finger breadths or less than 6 centimeters. And it is associated with difficult intubation. So for the 3-2-1 rules, each one of them is associated. When each one of these is correct, it is associated with difficult intubation. The first one is less than 3 finger breadths, the first measurement. The second measurement is less than 2 finger breadths, and the last measurement is less than 1 finger breadth. That's why it's 3-2-1 rule. 3 fingers, 2 fingers, and 1 finger breadths. Okay. The first measurement is the thyromental distance. The second one is the mouth opening. The third one is the anterior subluxation. Again, the thyromental distance, the mouth opening, and the anterior jaw subluxation. The thyromental distance, the mouth opening, and the anterior jaw subluxation. The thyromental distance, that's the distance of the lower mandible in midline from the mentum to the thyroid notch. Again, this is the distance of the lower mandible in midline from the mentum to the thyroid notch. And and then the mouth opening and the anterior jaw subluxation. Okay, 3, 2, 1. Then you have to assess the tongue size. You have to look at the tongue size, and in the case of dentition, any dental appliances, any retainers, any loose teeth, chipped teeth, because these all pose aspiration risk, especially when you are introducing the tools that when the anesthesiologist is inducing the tools into the mouth. The nasal passages, also you have to look at them, especially if you are planning a nasotracheal intubation. And you have also to assess for any difficult ventilation. And you have to look at the anatomical sites relevant to the lines and blocks. Any bony landmarks and suitability of anatomy for regional anesthesia, sites for IV, the central venous pressure, and the pulmonary artery catheters. Also you have back again, if we look at the difficult airway and the ventilation difficulty, we have two mnemonics that would help with that. For the difficult airway, we use the word lemon. For lemon, we have L to look, E to evaluate, M Mallampati score, O for obstruction, and N for neck mobility. Again, look, you have to look at the obesity, the bird, for male patients, the bird, the dental facial abnormalities, the neck, the facial neck trauma. E for evaluate, the 3-2-1 rule. Okay, M for Mallampati score, okay. O for the obstruction, like stridor and foreign bodies, and N for neck mobility. To assess for ventilation difficulty, now for the other one, which is the ventilation difficulty, we use the word bones. For bones, B is for the bird, O for the obesity. Well, that's when the body mass index is above 26. N for no teeth. E for elderly, that's for the age above 55. S for snoring history and sleep apneas. Then we move to the preoperative investigations. After we took the history and we did the physical examination, now we move to the preoperative investigations. In the preoperative investigations, usually these are only done if necessary, and so each one of them has an indication. CBC, we do CBC for major surgeries requiring group and screen, or cross and match. Also for chronic cardiovascular, pulmonary, renal, or hepatic diseases. Also for malignancies. Again for chronic cardiovascular, pulmonary, renal, or hepatic diseases. Also for malignancies. Also for known or suspected anemias, bleeding diathesis, or myelosuppression, and for patients above 1 year of age. the second test that we do is the sickle cell screening. So let me count them for you. That's the CBC first, which we have mentioned. Then the sickle cell screening, sickle cell screen, the INR APTT, then the electrolytes and creatinine, then fasting glucose level, then the pregnancy beta HCG, then the EKG, then the chest radiography, a chest radiograph. Okay, so the CBC, as I said, for major surgeries requiring group and screen or cross match, and chronic diseases in the main body system, the cardiovascular, pulmonary, renal, or hepatic. For malignancies, for suspected anemias, bleeding diathesis, or myelosuppression, and patients above 1 year of age. The sickle cell screening for patients from geographic areas with high prevalence of sickle cell disease and or genetically predisposed patients. Hemoglobin electrophoresis if screen is positive. Okay. INR APTT, we do this for the anticoagulant therapy as an indication, anticoagulant therapy, bleeding diathesis, liver disease. Okay. And the fourth test is the electrolytes and creatinine. We do this when there is hypertension, renal disease, diabetes mellitus, vascular disease, adrenal disease, digoxin, diuretic, or other drug therapies affecting electrolytes. I'm going to repeat them. Whenever there are diseases like hypertension, renal disease, diabetes mellitus, pituitary or adrenal disease, we do electrolytes and creatinine tests. Also, whenever there are drug treatments for vascular diseases, digoxin, diuretics are given, or other drugs that affect electrolytes, we also do electrolytes and creatinine tests. We do the fasting glucose level if there is diabetes mellitus, and we repeat that on the day of the surgery, the fasting glucose level in the case of diabetes mellitus. So we do this for fasting glucose level for a diabetic patient with diabetes mellitus, and we repeat that on the day of the surgery. Then we do a pregnancy test, the beta HCG test. We do that for women of reproductive age. The EKG test, we do it for patients with heart disease, diabetes mellitus, other risk factors for cardiac disease, also for subarachnoid or intracranial hemorrhage, also for cerebrovascular accidents and head trauma. The last one of these is the chest radiograph. We do a chest radiograph with patients with new or worsening respiratory symptoms and signs. Okay, so now let's move to the American Society of Anesthesiology classification of such a patient.